네, 그럼 지금
Now we'll begin the session promoting a more inclusive development cooperation for the post-COVID-19 era. Let me gladly introduce the moderator for this session. Professor Kim Sung-gyu from Korea Association of International Development and Cooperation. He's also senior professor, researcher of the Seoul National University. And he's also the head of the Center for the Sustainable Development. Please welcome our moderator, Professor Kim Sung-gyu.
Thank you. Good afternoon, everyone. Now we want to open our session with the theme of promoting a more inclusive development cooperation for the post-COVID-19 era. I am Sung-gyu Kim, President of KAIDEC and the moderator of this session. I am very pleased that this meaningful KOICA KAIDEC session is being held at Jejuporam 2021. As you know, inclusiveness is the not new word in the field of development cooperation. But personally, I am very convinced that inclusiveness is one of the most valuable keywords during and after the global pandemic that goes beyond the traditional mechanism of development cooperation. We hope that this session will be helpful in exploring new methodologies and strategies of development cooperation based on inclusiveness. Before starting today's session, Ms. Suk-ki Baek, Vice President of KOICA, will give you opening remarks. Vice President Baek asked for your understanding for the online remark due to another important schedule in Seoul. Vice President Baek, please, your opening remark.
Good afternoon, Professor Masato Noda of Ibaraki University, Dr. Sung-gyu Kim, President of Korea Association of International Development and Cooperation, presenters and discussants, ladies and gentlemen. I'd like to take this opportunity to extend a warm welcome to everyone here this afternoon, online and offline. It's a great pleasure for KOICA to host this session with the Korea Association of International Development Cooperation in Jeju-Forum. We have gathered here today to discuss how the pandemic has changed development cooperation and discover more responsive and inclusive path for the post-COVID-19 era. It has been more than a year since the outbreak of COVID-19. The COVID-19 pandemic has brought a huge impact on people, economies, and the planet, incurring more complex and diverse crises than ever before. It has taken more than 3 million lives, and it has pushed millions more into poverty. Fortunately, putting efforts together, we are beginning to slowly recover from the impact. Yet, we are well aware that the COVID-19 pandemic has widened the various gaps within our societies and pushed us back from achieving SDGs. The inequalities between developed and developing countries have widened and is expected to widen even more. The vaccination gap may be one of the various gaps that could drive another gap. This has brought us here today to discuss the implications of the pandemic to current work of development cooperation and how development cooperation should tackle this crisis and move on to better recovery. The COVID-19 is not just a health crisis. It's a shock economically and socially, reaches everyone, and it becomes harder towards the vulnerable. Partial recovery is not a recovery. Unless we achieve a complete recovery from this pandemic, there will always be a risk of recurrence. Considering its impact, effective international development is clearly essential for rebooting global sustainable development. To cope with the abrupt changes, demands to development cooperation has changed since the COVID-19. Building solid health system has become a priority. climate change is drawing more attention. Digital connection became the key to remaining connected. With the increasing demands in international public goods, we may rethink the purpose and scope of development cooperation to incorporate complex but interrelated environment, health, and economy. The pandemic may have caused dysfunctions of whole societies, but this could be the opportunity to make changes to broad international development cooperation conceptually and operationally to build better and inclusive recovery together. The COVID-19 pandemic has shown how all countries are connected. This underscores that cooperation, collaboration, and solidarity are the only way to end the pandemic, asking for strong partnership ever. To bridge the widened gap, international development cooperation also need to adapt to the changes, more inclusive and integrated. In this regard, KOICA has been expanding its role to overcome the pandemic and promote sustainable development. Agenda for building resilience against COVID-19 through development cooperation has been implemented in 116 countries to addressing healthcare fragility, building capacity in infectious diseases containment, and strengthening global solidarity. And it includes elements of green ODA and digital ODA, as these are non-separable for better recovery and responsive prevention to crisis. These may be linked to international public goods that are being under discussion. Also consider sustainable development in the post-COVID-19 era. KOICA is preparing for integrated programs for overall societal development rather than focusing on sector by sector. Under the predictable circumstances, KOICA is continuously working together for a better recovery towards a more inclusive, climate resilient, and digital economy, and striving to demonstrate its capability as the leading agency for development cooperation. Much of the world spent a year of isolation and emptiness, but the ODA remains a stable source for developing countries and for global recovery. And we saw the more inclusive international development cooperation is crucial and essential than ever before. With that, I hope today's seminar will be a meaningful occasion, contribute to uplifting awareness on the global challenges we are facing now, and sharing different perspectives on how development cooperation should get through these difficult times and work together to achieve sustainable development. Once again, I would like to thank to all of you participate in today's seminar. Thank you.
Thank you, Vice President Sukipek, for your meaningful opening remark for this session. As you know, KOICA and KAIDEC has been collaborating for a long time. So then has been holding a joint session for the Jeju-Forum since many years ago. I look forward to continuing collaboration related to development cooperation projects in our partner countries, as well as knowledge sharing. Okay, let's introduce now. Let me introduce today's presenters and three discussants. We have three excellent presenters and three discussants. First of all, may I introduce Masato Noda of Ibaraki University. Second presenter is Yuri Yoon of KOICA ODA Research Information Center. And third presenter is Professor Youngwan Kim, Hankuk University of Foreign Studies. Now, we will give the first floor to Professor Masato Noda of Ibaraki University, Japan. The title of presentation is SDG and Human Security for Leave No One Behind in with and post-COVID-19 world. So please start your presentation. And as you know, Professor Noda, you have 14 minutes for your presentation. Please, Professor Noda.
Thank you very much for kind introductions. Professor Seung-Gyu Kim, the President of the Korean Association of International Development Corporations. First of all, I'd like to show my deepest gratitude to give me the opportunity to make a presentation in this KOICA KAIDEC session of Jejuporam 2021. Well, and I also would like to say thank you very much to the Dr. Suk-hee Park, the Vice President of the Korean International Cooperation Korean International Cooperation Agencies. Well, I'm now, as introduced, the moderator. I'm associate professor with Ibaraki University. Ibaraki is outside Tokyo and in Japan. And I'm now the vice chair of the Development and Resilient Research Group of Japan Society for International Development, JASID. But and before, I used to work for the JASID almost a quarter of more than the quarter of the century, and served as a Secretary General and the Executive Director. At that time, I was committed to the partnership with KOICA for a long time. So personally, this is my great pleasure. And at the same time, on behalf of the JASID, I'd like to say thank you very much again to give me this very interesting and very important opportunity to enhance our long-time partnership between KAIDEC and JICA. Now, I'd like to make a presentation about the human security for Leave No One Behind in the with and post-COVID-19 world. I think that the COVID-19 pandemic is a crisis of the human security. Our Prime Minister Yoshihide Suga said that the spread of the coronavirus is a human security crisis, posing a threat to the lives, livelihoods, and the dignity of people across the globe. The guiding principle for us to overcome this crisis must be leave no one behind. Briefly about the background of the concept. The human security is proposed in the United Nations, firstly in 1994. And the leave no one behind is the motto of the 2030 Agenda for Sustainable Development and the including SDGs. And I think that in the background of the philosophy of the SDGs, leave no one behind, I think that the human security should be there. So why I highlight the human securities concept? Actually, the human security is the core concept of the Japan International Development Policy. And we have a cabinet decision on the Development Cooperation Charter 2015. And this is the basic the policy of our international development cooperation. And it says that human security concept that pursues the right of the individual to live happily and in dignity, free from fear and want, through their protection and empowerment, is a guiding principle that lies as a foundation of Japan's development cooperation. Japan will just focus its development cooperation on individuals, especially those liable to be vulnerable, such as children, women, persons with disabilities, and elderly, refugees, and internally displaced persons, ethnic minorities, indigenous peoples, and provide cooperation for their protection and empowerment so as to realize the human security. And according to the concept of the human security, it will support also the national security, but the global threats like conflict, terrorism, and of course, infectious diseases, including COVID-19, directly damaged to the individual. That is why not only a state security, but also the idea of the human security is important. So regarding to the health and the human security, human security protects the vital cause of the human security, human lives in a way that enhances human freedom and human fulfillment. So we need to think about the relationship of the security, the human security and the health. Both of them are the relationship. Both of them are the purpose and the end at the same time. So protecting protecting the health, the core health is the core of the human security, and at the same time, health is a mean to realize the human dignity and the human security. Regarding to the SDGs and the COVID-19, according to the UN report, the COVID-19 is a matter, first of all, COVID-19 is a matter of the health, but at the same time, its effect on each dimension of the sustainable development, economy, society, and the environment. For instance, well, this is the case in Japan, but the COVID-19 pandemic affected to the economy. But at the same time, in Japan, the many of the women are non-permanent workers. That is why this also damaged to the employment of the women, and they are very much vulnerable. And because of that, many of the women lost their job. That is why the social the inequality become wider and wider. So we need to think about the interlinkage of COVID-19 and the interlinkage of the SDGs. This is very much dimensional the problem. So under this situation, who left behind? And we need to think about the new poor and the new vulnerable. COVID-19 do not choose the people. And everyone, including us, has a risk to be infected across the border. So this is not just a matter of somewhere else or only in the developing countries, but this is also our matter, Korea and Japan. But its impacts are not equal. And COVID-19 exacerbate pre-existing vulnerabilities, and it makes the new poor and the new vulnerables. So there should be further risks of with post the COVID-19 world and its impact in Asia. The first, now in Japan, we just finished the state of emergency in the fourth wave of COVID-19 outbreak. But we should take care that the following wave of the pandemic may come. And secondly, pre-vulnerable medical system may be collapsed. Then we may face the risk that health service cannot be affordable to the other diseases. So, so this is not only the case of the COVID-19, but there are a lot of patients who can't access to the hospital because the patients who have other diseases cannot access to the hospital. The third one is the financial crisis, debt crisis and financial crisis because of the shrink of the economy. The fourth one is exclusion and the instabilization of society. In the case of the women's exclusion, as I mentioned, but also a lot of low income and vulnerable people should be excluded. And the potentials of the economic growth and development opportunity may lose in the long term. Because the pandemic disturbed international movement of human resources, goods and the service, finances, and information, as well as international cooperation. And under the social COVID-19, our society faces the social divides. And focusing on the education, for instance, the first, the regional divides. The second one is the digital and the ICT divides. Probably the same as in Korea and the other countries under the school closure, we conducted online lecture, but some are not affordable to access to such kind of the online teaching. And the third one is the social and the economic divide. Even before the COVID-19, our Japanese society faced social divide and the poverty in our country. For instance, 1/6 children are suffering from the poverty. In the house of the single parent family, mostly single mother are poor, and 40% of the employees are non-permanent. And if possible, I would like to share the common experience of the Korea and the other world. And the other point is that my place, the Ibaraki, is the leading producer of the agriculture product to Tokyo and the rest of the part of the country. And we employ a lot of international laborers and foreign workers, mainly from Vietnam and the China. But because of the COVID-19, the situation is so miserable and they are so very much affected. And our Japanese government support those countries. Well, support to the China is already over, but we still continue to support other Asian countries like Vietnam and the Philippines and so on. But we need to pay attention to the people, those who are in the country, but also the migrated, the person, especially to Japan. And I think that Korea also has a similar kind of experience. So I would like to, if possible, I'd like to share the idea. So anyway, the point is that international cooperation, development cooperation is now not only the matter to supporting the developing country itself, but also we need to pay attention to the migrant workers and the vulnerable people in our country. I'd like to introduce Japan's SDGs action plan. We have 3 pillars. The first one is the Society 5.0 for SDGs. Society 5.0 is the concept to use AI and the Internet of Things for the inclusive society. The second one is the localization of SDGs and resilient and environmental city planning. And we designated some SDGs city, and we will promote the bottom-up approach for the sustainable development.
Sorry,
And
Professor Noda, you have only 2 minutes. Sorry.
Yes, I know.
Okay.
Thank you very much for your noticement. I have my own watch. Thank you very much. The third one is the empowerment of the next generation, including women. And in Japan, we also have some area left behind, but we need to focus. We need to pay attention that those areas is vulnerable, but at the same time, they have own the mechanism to cope with the outside threat like COVID-19. For instance, in the case of the Toshijima Island, where I have the field research, that's a small island and very much remote from the mainland. But the effect of the COVID-19 to the island is quite limited. There should be some reasons, but what I want to emphasize is that, hang on, please. Okay, they have a sustainable livelihood and they have a brotherhood system in the community. So, helping the most vulnerable people for all. The world was threatened by global infectious diseases, poverty-related threats, and violence. But in this global world, no community can be entirely impervious to these courteous diseases. And I'm afraid that now some countries are in the process of recovering, but in this case, this kind of the K-shaped recovery could be happen, so we need to take care about it. And finally, I would like to introduce the statement of the Kenji Miyazawa, Japan's the poet. Individuals cannot be happy until the whole world will be become. So we can say, individuals cannot be safe from COVID-19 until the world becomes. So wish you safety and see you face to face after COVID-19. Thank you very much. 감사합니다.
Thank you for your wonderful presentation, Professor Noda. It was very meaningful and good opportunity for us to understand Japan's policy for international development cooperation responding to COVID-19. So, thank you for your presentation again. And as you know, is moderator. One of the most important role is moderator is time management. So please, your understanding of my intervention for the time management. Okay, thank you. Now we invite a second presenter, Dr. Yuri Yoon of KOICA. Title of the presentation is Integrated Development Cooperation for Better Recovery in the Era of COVID-19. Please, Dr. Yoon, you have also 14 minutes. Hello.
Thank you.
Okay,
Yes.
please. Okay.
Good afternoon, everyone. Thank you for giving me this opportunity. And as the president of KAIDEC, Dr. Kim mentioned, KOICA and KAIDEC has been working and cooperating for a very long time, especially participating in Jeju And it is a great pleasure to present here today. My presentation will be Integrated Development Cooperation for Better recovery in the era of COVID-19. And contents. It's not. The slides are not moving. Yes. No. Yes. Can you see my pages?
Yes, we can share your PPT and then some technical problem for you to manage.
My pages are shown, but I don't think it's showing there, is it? I'm not sure.
Now it's okay.
Anyways,
you can see your slide.
Okay, thank
okay.
you. The contents are as follows, and the map we're looking at here today is the map of showing how the world is with the COVID-19. And this shows the map of June 9th, which was a week ago, I guess. And it's already 173 million cases have been confirmed. And as of today, it's more than 178 million of cases. So rapid spread, and it's all over the world, as we can see. And currently, COVID-19 Delta variant spreads quickly around the world. So we might be worrying about entering into another new phase of crisis. As we all know, COVID-19 has changed many of our lives, and the various gaps and inequalities that exist throughout our society have been widening due to COVID-19 and revealing that even the virus was not equal. It was harsher to the poor people and fragile people than the rich ones. So, and low, as the graph shows, low-wage workers have more job losses than high-wage workers. And the internet access can be seen less relevant, but internet access was the key to remain connected in the social distancing society. So depending on whether you have internet access or not, it was determining whether you could still continue your social life or not. So that was key. And it was told that COVID-19 was caused by climate change, and developing countries were more vulnerable to climate changes. And as a result, the effect of climate change to GDP shows negative as well, as the graph shows. And the last one shows expected vaccination coverage, which you can see that it's more concentrated on developed countries instead of developing countries. Now this would be another issue, as this would be telling that we will be making more gaps between developing countries and developed countries. On the other hand, development cooperation has an increasingly diverse and universal nature. And although it may have started with relatively narrow perspective of focusing on economic development, today development cooperation represents a variety of influences throughout our society. So we've been moving from economic development to including even to environmental sustainability, which are all included in SDGs. And now that we're hit by COVID-19, it is returning back to, once again, returning back to development cooperation because it has highlighting solidarity and greater international cooperation. And perhaps this would be an opportunity to change the fundamental change. And the developing countries are more vulnerable to global challenges such as communicable diseases, COVID-19, and climate change, and quality development cooperation is more significant as it may be the foundation for overcoming the crisis. So that's the necessity of development cooperation in the world today. But the one other issue would be the donor countries or developed countries are also facing this COVID-19 crisis, which makes shortage to development cooperation resources because they're also putting their recovery at first, and they also need to think of budget pressures while their monies are used for domestic issues. So then we should ask what would be the role of ODA in COVID-19 era. Development cooperation have been discussing its scope and measurements as the environment continues to change. And these changes may have include COVID-19 long before it happened. This new measurement, total official support for sustainable development, is designed to monitor all official resources flowing into developing countries for their sustainable development, including private resources mobilized through official resources. So it got very larger purposes instead of focusing on economic development. And this unique measurement includes the international public goods, which is in Pillar 2. And whether this could replace ODA or not, we do not know, but the direction of TOSSD may suggest some meanings. Our support is being used in developing countries and effectively fund where it is needed, etc. in COVID-19 era. So we were talking about this long before COVID-19 was here, but since with the COVID-19 today, we might reconsider what this is giving us the meaning that how the ODA should be considering COVID-19, or some would say that this vaccinations and medications will be international public goods or not. While these discussions are going through, whether ODA should be supporting this or not, that's another question. So these are all complicated issues, but we need to find out what we can do and what we cannot. And then will this international public goods, or the definition of international public goods would be the goods with provides benefits that are non-exclusive and available for all people, and that would include developing countries and developed countries, and because of this, providing benefits to both or everyone, the ODA or development cooperation is considering whether we should include this or not into the system. If it's going back to developed countries, and what's the purpose of doing it? So, but considering the circumstances today that we're facing, whether we provide any solutions to developing countries only, if you cannot make the solutions at our own country, then it will never end. So whether, it gives you a lot to think. And it's not just the COVID-19, our climate change issues are the same. Reducing carbon in one country does not mean anything, more likely. And then the digital as well. So these issues provide you many thoughts on what we should be considering as ODA or developing, and what we cannot include into it. But as we're talking about inclusiveness, and we are saying that we need to become more inclusiveness, perhaps this is an opportunity to include this crisis issues into ODA, and then providing these necessary supports into necessary places would be great chance to enlarge the scope and the measurement. While this crisis is ongoing, it is said that the COVID-19 is increasing dependency on importance of ODA because the private finance inflows to developing countries are dropping. And by the OECD report says that it'll drop by 700 billion and then probably more. And that is exceeding the impact of 2008 global financial crisis by 60%. So it's critical. And then it doesn't mean that without these money or the investments that developing countries could figure out other ways to find their own sources. So it just means that they have more dependency on ODA, and they would consider ODA as more important. And then that would give us the implication that we should consider very seriously on where to put the resources and how to put the resources where. So these are the ongoing issues, I guess. And also we need to think of how we could replace these private investment with ODA and reduce the gaps threatening resilience and increasing crisis management ability, so that in the coming future that they could be better responsive to whatever is coming to them. And then also we need to think of strategic foresight, so that they could forecast what's going to hit them, and then they could prepare ahead than just being hit and then try to recover it from there. And not to forget, it requires much discussions on the scope and the role of ODA in relation to global public goods, as challenges have grown from country issue to international issues. So long ago, it may be developing agricultural area or developing certain products or roads, transportation system, but now it's going to global. The issue itself is going to global. So whether ODA remains focusing on the traditional terms of ODA and growing together to enlarge them into international issues, that we need to discuss on.
Dr. Yoon, you have 2 minutes, please.
Okay, yes. And pandemic has shown the need for investment in global public goods and resilience mechanisms, as I've mentioned, and it's also mentioned in OECD reports. And there I find that the development cooperation role in international public goods would be perhaps researching for the innovation and technology, because that would be more of basic fundamental work for whatever it's going to be in the next step. And it's where we could link from technology to the market. So create not just providing something, but creating the ways to the market from a product. That would be the role of ODA perhaps, and then allowing them to absorb shocks and risks would be another role of ODA in IPG. That's just my consideration. And more inclusive development cooperation for post-COVID era would be required, and that does not just mean the definition, but also the finance system. We have been expanding from including administration cost and development awareness spending, et cetera, and then to the security and peacekeeping. So it's not the first time that we are trying to expand the scope of international development. So maybe this is the chance. We do not know, but maybe. And also the participants, more participants we need, and then program and product content as well. So as Vice President of KOICA mentioned, that we're considering of integrated program approach as well. So those changes are required. And skipping all these because I have very less minutes, KOICA has been working on, as mentioned, ABC program and expanding to green ODA, digital ODA, integrated ODA. These I think you can read later on, but it's it's not just providing the kits and etc., but also allowing them to grow on their own ability to prevent themselves from the crisis they're facing. And just to sum up, COVID-19 has widened the various gaps, yes, we know, but and we now need more efforts to overcome the crisis. And then for that, we need collaboration and integration with the inclusiveness included. And the gap will continue to widen without expansion of resources in terms of both finance and participants. So everybody together, and then we need to work together. And we need to remember that some recovery is not recovery. So until the fully recovered, we cannot say so. And then until then, we need to work together, I think. I will finish up my presentation here, and thank you for listening.
Dr. Yoon, thank you for your meaningful presentation, and sorry for our time limitation. Dr. Yoon said during the COVID-19 pandemic, the dependency of ODA in developing countries is very increased. That's because we should more focus on the linkage or nexus of financial system and participate and contents of projects in programming of ODA. Also, she mentioned about the importance of resilience of responsiveness and inclusive also. Thank you for your wonderful presentation again. Now we invite the third presenter, then Youngwan Kim, Professor Youngwan Kim at Hankuk University of Foreign Studies. He will give the presentation with the title of the social, economic, and psychological impact of COVID-19 on children in Kenya and Zambia. Please, Professor Kim, you have also 14 minutes.
Thanks a lot, President Kim. Hello, my name is Youngwan Kim from Hankuk University of Foreign Studies. It's my honor to make a presentation here at Jejuporam. Please show me the slides. Okay. So the first two presenters provide the strategies and provide the analysis of the macro level response to the COVID-19. I want to approach this matter in more micro level. So we try to understand what really happens in Kenya and Zambia. We want to see the reality happening in sub-Saharan Africa. That's why we choose Kenya and Zambia as a target country of study. So there are two major research questions. The first one is to see the real impact of COVID-19. And second one is we want to focus on children in Kenya and Zambia and to see how and whether they were influenced by COVID-19. And also, this project is funded and implemented with Good Neighbors, which is largest NGO in South Korea. They've done lots of jobs in sub-Saharan Africa, especially they focus on community development project, which called CDP. This is kinds of comprehensive development project they implemented in many developing countries, especially in the sub-Saharan Africa. They build schools and hospitals, and they provide sometimes health educations to villagers. So many villagers are kinds of beneficiaries of this CDP project. And also, as you may hear, as you may know, as you may be familiar with, there is a child sponsorship program. If you donate like $40 and that money goes to one specific child. So to understand the real impact of these two projects done by Good Neighbors is also one of my research questions. I think Dr. Yoon already shows the situation about the COVID-19. An interesting thing about COVID-19 sub-Saharan Africa is that actually the number of infected cases and death toll is smaller than the other areas because it's hard to get tested and it's hard to track the cause of death. And also demographic characteristics contribute to the small number of COVID-19 confirmed cases and death toll. But as you may imagine, the situation of socioeconomic conditions in sub-Saharan Africa is way, way worse than the other developed countries because there's no support from the government, and also it is hard for them to receive support from international organizations as well due to COVID-19 situation happening in developed countries. So COVID-19 affects both developed and developing countries as well. So there's lots of studies, existing studies about socio-economic impacts of COVID-19 and also psychological impact of COVID-19. And importantly, if you see these here, children are affected by COVID-19 from individual level and also family level and community level and structural level as well. We focus on community level and family and individual level. The reason why we pay attention to CDP is that how community can protect children, and also child sponsorship program is directly related to family and individuals. We cannot do the field research. Well, usually I go to the field and make interviews and focus group interviews and key informant interview and conduct surveys. But for sure, COVID-19 prevent our team to go there. That's why we have done this research project all online. And we did the online key informative interviews, and we asked Good Neighbors Kenya and Good Neighbors Zambia staffs to conduct focus group interview and survey as well. And I mean, they really did impressive job to conduct these key informative interviews and focus group interview and surveys. That's how we were able to collect the data in the field. So these are list of key informant interviews and focus group interviews. And we got 843 respondents from Kenya and Zambia. And we also set up the control groups to understand the real impact of CDP and child sponsorship program. And this is how they do in Kenya, what Good Neighbors do. They have several CDPs, and through CDPs, they implemented development project comprehensively. I mean, I was impressed when I've been several CDPs in Tanzania and in Malawi and Dominican Republic, and they've done excellent job to make villages better in terms of comprehensive development. And they also respond to COVID-19 very quickly to provide masks, health materials, and educations as well. And Good Neighbors Zambia, they did several similar things for the Kenya, and they got several CDPs in the field, and they also respond COVID-19 very quickly to address the issue of COVID-19. So first of all, let me show the impact on household in terms of socioeconomic conditions. As you can see, the monthly income before and after COVID-19, see the difference between these two, and there are about 40% decrease of monthly income. In addition, they got some level of decrease of remittance. And this is the monthly income in Kenya. They got about $81 US dollar, but that income becomes $52 US dollar. In Zambia, the monthly income is lower than Kenya, and it used to be $31 and it became $21 now. So this is very clumsy assessment about how their income has been decreased, but at least we can get the picture of what's happening in Kenya and Zambia. For sure, these households were severely affected by the COVID-19, and due to the loss of job and loss of income and the dead family members. And also, another serious impact about COVID-19. I'm sorry, let me move to the more important one. Okay, here's the stress and depression. As you can see, about 60% of respondents said that they experienced really hard, really big stress about parenting itself, because children do not go to the school because school was shut down due to COVID-19. And also, the level of depression is quite high, as you can see. And that causes the conflict and tensions between parents and children. One interesting story about the stress of parents is that the richer the families are, the lesser the stress are. And actually, due to COVID-19, rich families get together easily. They stayed at home, right? They talk, and they communicate each other. So they actually get the better relationship. But in poor household, tensions and depressions gets really high, especially in sub-Saharan African countries. And let me move to the psychological and children's perception of COVID-19. We got several cases about how COVID-19 affects boys and girls. The impact was a bit different. As you can imagine, the boys were forced to work, forced to find the work and to earn money. For girls, young girls, they were actually sexually sometimes assaulted, even by their own father sometimes. There was really, shocking stories, but we approach this matter more in quantitative way. And as you can see, how COVID-19 changed your daily lives, and many children says very negatively. Can you see? They say negatively or very negatively. And also, the effect of COVID-19 on my life is going to be very, very negative. And you can see there's quite stress of children. Children were severely and psychologically affected by COVID-19 in these circumstances. And also, children perceive COVID-19 as the factors to affect their lives in a very negative way. I don't want to go over all details of statistical models. And also, here's another important findings that I really want to share. This might be the most important finding that I want to present today, which is the hope of children. We got hope index. Through this index, we can see how children perceive the future hopefully or not. So in this statistical model in Zambia, as you can see, we compare non-CDP, so they are not included as a target of CDP of good neighbors. And we got CDP non-sponsored, CDP sponsored. That means this group is one of CDP, and this group receive child sponsorship. This group only receive CDP. So this group is only the target of CDP. Can you see the a bit difference here? It's non-CDP, which do not receive any child sponsorship and which is not a target village of CDP. Their hope scale is way lower than the other. Can you see the similar patterns in Kenya? So basically, what good neighbors are doing in the field, which is CDP and child sponsorship program, is actually make child and children think about the future more hopefully. I mean, we were a bit surprised because we first thought that they were so depressed and they never care about the future, and the CDP, the impact of CDP and child sponsorship program will be a bit lower. I mean, that's what we expected, but the finding-wise, we show that children who are received child sponsorship and children who are target of CDP is more hopeful than other children. After COVID-19, we will see totally different development cooperation. The plans and strategies after COVID-19 will be all changed, and we have to approach this matter, and I think COVID-19 will stay with us for at least 2 years, probably 10 years. So we have to think about COVID-19 issue whenever we consider or we implement the development project. This is it. Thanks a lot.
Thank you, Professor Kim. You gave us a good opportunity to understand the social and economic and psychological impact for the children in Kenya and Zambia. He mentioned about the limitation of CDP projects under COVID-19, that because we need more development cooperation project for children and support program strong considering the pandemic situation. Thank you again for your meaningful research result. Now we have three distinguished discussants. You know this. We have Im Eun-mi, professor of Ewha Women's University, then Shin Jae-hyuk of Korea University, and Park Kyung-yeol, professor of KAIDEC. So each panelist have 7 minutes, then as previously announced, and with discussion with designated discussion. Please now let me invite our discussion, starting with Professor Im.
Good evening, and first of all, I'd like to thank you, Professor Noda, for the very informative presentation. Because of the very short time, so I'd like to directly move into my kind of present, but my point on also on his presentations. So I'm not sure because here. Professor Nora started with the question, who are the left behind and how can the vicious cycle be terminated? And he talked about the new poor and new vulnerable. Yes, indeed, because everybody has been affected by this pandemic. But especially in the field of, or in the context of development cooperation, I would like to say that still this, rather than new poor, maybe we still need to see these so-called old people, and they are become more vulnerable. So my question is whether Japan's development cooperation for the old, poor, and more vulnerables been changed or still the same. So let's say, according to the report, by 2030, which is the year that we target for the SDGs, but as you can see, there will be more poor women than men. So we all know that women have been much more negatively impacted by this corona pandemics. So here, I would like to talk about the COVID-19 pandemic-induced poverty, because it's what Professor Nora mentioned. But again, how I will say in the field of the development cooperation, how more women are being pushed into extreme poverty. So first, I looked at the OECD credit reporting system, which is ODA data, I only look at, because of time limit, only look at the 2019 Japanese bilateral ODA data. This one, and then so maybe I'll just use this one. Is this okay? Here you can see that also Professor Noda mentioned about the importance of education and health sectors. But so here among this is out of total Japan's bilateral ODA, you can see that only 0.4% or less than 2% and so forth. Very small portion of Japanese aid went to the educations and also sectors. So I'm gonna move to the next one. So here, we know here, who are the vulnerables? When we talk about the inclusive development, whom are we talking about? So there are, ethnic minorities and the women and children and so forth. So I'm going to talk about this time only on women gender issues. So here is the two data. Gender marker 1, here you can see is the Japanese aid, which is distributed to the sectors or the project and program, which target women as a secondary, okay, not as a primary purpose. It just happened that women become the beneficiaries. But the gender marker 2 is the number shows that Japanese aid actually indeed this amount Japanese ODA has been designed to target women and girls. But as you can see here, the education sector, 0.04% of Japanese ODA, which is one of the largest DAC donors, has spent this small amount on education, which is women has been indirectly benefited. But when you look at the gender marker 2 data, Japanese aid for education, you can say almost none for general education, basic education 0.01%, secondary education 0.1. You can see also health, very small portion. So also the Professor Noda mentioned about the importance of aid for the development cooperation for water supply, sanitation, hardly none. So we're talking about inclusive development cooperation strategies, but who are we talking about here? And in Japan is the leading and very powerful donors. So what are we doing here? Let's look at the sort of reality check. So my point is, yes, Professor Noda has mentioned and then pointed out a very important point about, especially about the Japanese effort and strategies to proceed with the inclusive development cooperations. But I think it's for us to do a reality check or time to check the realities, just like data. Let's go back to data and then see, let's have a backtrack on Japanese commitment to leave no one behind. And also maybe, I don't know if it's the right term or not, reset is maybe not the right term. I don't know which English term will be better, but we really need to revisit or reconsider Japanese coronavirus response to the old poor, which has been women and children and other minorities and so forth. We need to have a very strong and very effective and meaningful coronavirus response to this old poor and the new vulnerables. And so my question for Professor Noda, do you think this coronavirus will give us some kind of turning point for Japanese ODA development strategies by looking at this kind of number when it comes down to the inclusive development? And so, and if so, I would like to know whether there has been some changes and then some kind of reform has been made from the Japanese the government. Thank you very much.
Thank you very much, Professor Im, for your interesting comments and good questions. So Now we invite the second discussant, Park Kyung-yeol, the professor of KAIDEC. You have also 7 minutes, okay? Please, KAIST. Sorry.
Thank you very much. Thank you very much, President Kim. My name is Kyung Park from Korea Advanced Institute of Science and Technology, KAIST. Thank you very much for this great opportunity. So I think I will be very brief. I'm supposed to discuss Dr. Yoon's presentation, but at the same time, some of my points are also related to other presentations. So hopefully my comments are useful to the session. So I basically have like two main points. The concept of ODA that the Dr. Yoon actually questions, and also the concept of the SDGs, the relevance of SDGs in this pandemic era. So in the second part of Dr. Yoon's presentation, so she pointed out that we need to go beyond ODA and then kind of existing global mechanisms. I also think it's time to question the fundamental basis for ODA and also its legitimacy in the global, fast-changing global field of international development cooperation. Because of this increasing aid heterogeneity, we have a lot of non-OECD actors, increasingly important development finance, private sector's engagement, etc. So especially during the COVID-19 response, it's not just about ODA from donor to recipient. It's not just about South-South cooperation, but it's about global solidarity, Dr. Yoon just mentioned. Also in terms of aid modality, it's not just about emergency responses. It's not just about regular development aid. It's more about development financing, how we can actually reconceptualize this concept. So, so I was wondering, one of the missing components from your presentations was how Korean government responds this change and how is shaping the new development policy. So if I may, I'd like to put the question in a slightly different form to the Korean government. How do we build a new governance structure that can reflect this fast-changing situation? I'm not talking about the traditional fragmentation between the grant side and loan side, but at the same time, you mentioned about the importance of data sharing between the different stakeholders. So I think maybe it could start from the sharing data and establish the national single window information systems for enhancing transparency, and where is the the gap between the what we are doing and the current needs in recipient country. And that also leads to the data-driven data targeting, as well as the internal digital transformation in development agencies. And my second point is about SDGs. I know it's a kind of huge question, but are SDGs still relevant and effective? I personally think that there's nothing else to replace the SDGs right now until the 2030. But I think we need to think about, in the aftermath of the COVID-19 situation, SDGs are seemingly not the best framework for policy guidance in developing countries. Many indicators of SDGs are already seemingly irrelevant for measurement and responding to COVID-19 situation. And also there are a lot of trade-offs, which is interconnectedness in the new reality of the pandemic. So for the last 5 years, from 2015 to 2020, just before the COVID-19, also in Korea, we established the KSDGs. We have relatively inclusive process, including a lot of civil society organizations and diverse actors. Also, I greatly learned from the Professor Noda in terms of Japanese action plan for SDGs. But moving forward this for donor country side, the SDGs also need to reframed and restructured into feasible and more inclusive life-saving actions in public health. So I think this is the great time to think about this kind of restructuration of the SDGs components. SDGs will remain relevant in many countries, but only if governments reframe the goals to be part of the fabric of people's life, especially in health sector. So I think the development cooperation should focus on development itself, which is well-being, rather than a growth, the increasing economic output. So I think this is my comments. Thank you very much.
Thank you, Professor Park, Professor of KAIDEC School of Science and Technology Policy. So our last discussant is Shin Jae-hyuk, Professor of Korea University. Please, your discussion in 7 minutes.
Okay. Thank you. I'm going to discuss Professor Kim's research. Professor Kim, I think you have really good research project. I especially like your focus on the children into sub-Saharan Africa, Kenya and Zambia. I think the children in those countries should be the most vulnerable people, right, during this pandemic. And I hope you can get this published soon, so that many people can see your research. And for that, I'd like to make some comments on the question and the theory and some empirical findings of your research. First of all, in the 3 research questions you presented today, the third one, you said analysis of COVID-19 impact on CDP and child sponsorship program. But I think what you really showed today is the impact of CDP and child sponsorship program on the children's perception of COVID-19, right? And also after this, I'd like to see some theoretical arguments about why we can expect to see the CDP and child sponsorship program can improve, right, children's perception of COVID-19. And after that, I'd like to see some testable hypotheses, right? And I think it will be a more efficient way to show you results by testing those hypotheses. Also, maybe because of this time limit, he didn't present all the findings. But actually, he has many interesting findings out of this statistical analysis. One of them is interaction effects between CDP and unemployment on the depression or perception of COVID-19 on adults. And it seems that the impact of these interaction terms are quite strong, but I'd like to see some graphs visualizing this, the results, because by looking at this table, it's hard to understand what's really going on. Also, he has really good, interesting findings about children's perception of COVID-19 in those 2 countries. And in the table, what really interests me is the difference between those 2 countries, Zambia and Kenya, in the impact of school attendance on the children's perception. In Zambia, the school attendance seemed to have no influence. But in Kenya, it seems that as school attendance increases, the children's perception of COVID-19 get better, right? So that can indicate that the school attendance is quite important, right, in children's perception. Also, he pointed out that children's perception in disaster and crisis are strongly influenced by their parents' perceptions, right? And he also pointed out that this result is consistent with the existing research, and I found it really important finding as well. Okay, finally, I'd like to see some policy implications of this very important and interesting research. Okay, so if CDP and child sponsorship program have a really good impact on the children's perception, then what should be done, right? So I'd like to see some policy implications. Okay, thank you very much.
Thank you, Professor Shin. Now we have a Q&A session. Originally, we want to have a Q&A session include online participants, but because of the time limitation, so sorry. Each speakers can answer for the comments and questions of three our discussants in 2 minutes. Please, starting with Professor Noda and Professor Yoon and Professor Kim, please.
So thank you very much, Professor Kim Hyung. And I also would like to show my deepest appreciation to the designated discussants, especially the Professor Lim Yumi. Yes, I basically agree with your idea. First, what I want to say is that briefly, we need to change our ODA policy as well as our society itself, especially in Japan. Well, as you know that, everyone knows that the title of the 2030 agenda is transforming our world. Of course, at that time, the agenda is adopted in the UN General Assembly in 2015. Nobody expected the COVID-19. But when we face this global crisis of the COVID-19, we really seriously think about to transform our world. The first, yes, of course, Japan's the ODA address to the old poor, but at the same time, we need to address the new poor. Well, at this moment, because still the pandemic of the COVID-19 is going on, we can't expect that who will be the new poor. But just one case, in Japan, as I mentioned to you, we have a lot of migrant workers from Vietnam, China, and their remittance to those countries a huge amount for their household. So in that sense, before the COVID-19, the incomes and the living standards of those families should be not so bad. But once this happens, no remittance. So that is why there would be a new, the poor. And the same thing happens, well, my main research area is in the China Peninsula, but a lot of Cambodian peoples and Myanmar's peoples work for the migrant workers in Thailand. So the same things happen. So my answer is that it should be inclusive, both new poor and the old poor. And the second one is that Japan's ODA have to focus on more health and their education and rather than the infrastructure as all the type in order to address this global crisis. I totally agree with you. And actually, in the UN General Assembly, our Prime Minister mentioned about the support through the idea of the universal health coverage, that is in Sdgs. Number 3. And regarding to the gender, well, I think that this is my personal idea. Our society itself should be more gender sensitive. Well, according to the World Gender Ranking of the World Economic Forum, our score is not so bad, not so good. So in a sense, this is this crisis should be an opportunity to change our Japan's ODA policy as well as Japan's society a more inclusive way. So I wish that our Japan and our academic will contribute to research, and through the research and the education, we will contribute to the change the policy and a more inclusive society with our Korean friend and the rest of the world. Thank you very much.
Thank you, Professor Noda. And next, Dr. Yoon, please, in 2 minutes. Sorry.
Sorry. Thank you for the comments, and I will make very short response to the questions. Yes, I think all of this goes back to COVID-19. I think it changed everything and revealed that reveal what has been hidden or what was we were ignoring to see, so that it's suddenly there. Then we need to all focus. Data, yes, we need to know who's doing what and where, and it's very important. And for that, I think the government's green ODA and digital ODA makes sense. Putting a lot more in investment to those focal areas, we would be able to connect, or we will be able to build more capacity for the responding to those crises, and continue so that the government or KOICA should continue what has been planned to do in a big frame. And considering last year when COVID hit hardly and everything was shut down, the government tried to get back onto their budgets to put the budgets into domestic issues first. And lots of agencies had to send their budgets back to the government, where the ODA budget was remained there. I think that shows how the government is willing to cooperate internationally and try to, or how the government is putting lots of impression, yes, a lot focuses on there. So that would, I think that explains how the Korean government is looking at, although they're not really making any slogans or titles, fancy titles to guiding us to better ODA directions, but I think we could stay here, and we're making small changes as a beginning to respond better to what's happening outside the world. And we are also starting to building digitalization within KOICA and then within the projects that we're doing, so that we could open up our data to others, so that the others could access to better to what we're doing where, and how long we're staying there for which projects. So that would perhaps be the beginning of sharing data, so that we could invite more participants into our projects. And whether the SDG would remain or should reframe, I do also agree that SDG has too many goals, which does not suit today. And but luckily enough that we know where to focus. So I think perhaps we won't be able to change any details of what we should do for SDGs within the short future, but in a longer period, I think we will be able to come up with a better framework for the next generation. That's it. Thank you.
Thank you, Dr. Yoon. The last answer is Professor Kim in 2 minutes.
Thanks, Professor Sin, and you showed several findings which I actually skipped due to the time constraint. And thanks a lot. And answering 2 questions mainly. First one is, what's the theoretical understanding of how CDP and child sponsorship program can lower the stress and can increase the hope index of children in Kenya and Zambia? Well, if you see the CDP, it, as I said, is comprehensive approach to the village. So it provides the protection for the whole village, and also child sponsorship program provide some support for the family. I think the protection of in the level of community and in the level of family that actually makes children more hopeful than the other children who do not receive this CDP and the child sponsorship. And the second important question is about the policy implication. What's going to do, right? And we provide some policy implication saying that we have to support children in sub-Saharan African countries, the psychological support, especially counseling and home visit. Before, we only provide some economic supports, like directly the money or donation. But in the situation of COVID-19, those supports are not enough after COVID-19. So we have to stress the importance of psychological support on children in Kenya and Zambia.
Thank you very much. Now we will have to finish our session today. Thank you for all for the participants and speakers and discussion. Thank you again. Thank you very much.
Thank you very much.
네, 다시 한번 무대 위 자장, 발표자, 토론자분들께 큰 박수 부탁드립니다.
Once again, please give them a warm round of applause. With this, I would like to wrap up this session. Thank you very much for listening.